Hi, it's Dr. Wells, and I want to take a few minutes to review what obstructive sleep apnea is. I realize that many of you get this diagnosis and you're sleepy and kind of overwhelmed with the whole sleep test experience. And so I just want to take a few minutes to get back to the basics and help you understand why it's so important to treat this condition. Obstructive sleep apnea is a breathing disorder that occurs during sleep. So you're unconscious when it's happening. And there's two problems associated with obstructive sleep apnea. The first is when the muscles in your body relax, and particularly the muscles in your throat, when those relax during sleep, people with obstructive sleep apnea have collapse of the airway to the point where they're not able to get air into their lungs appropriately. So blood oxygen levels dip during sleep. And as you might imagine, your brain is quite sensitive to that. So your brain signals the alarm for awakening to re-engage those airway muscles and open up the airway again. Most of the time, this is associated with snoring, but not always. So again, the two problems are low blood oxygen level because you're not getting air into your lungs with the obstruction. The second problem is sleep disruption. So that you can breathe, you need to kind of open your throat again by purposefully re-engaging those muscles. So it's disruptive to your sleep and it causes your blood oxygen levels to go up and down throughout the night. As you might imagine, these problems create a cascade of negative effects, including daytime symptoms like problems with memory and concentration, problems with mood, and for some people whose jobs require vigilance or anyone who drives a car, this sleep disruption and low oxygen to your brain can cause a situation where you're putting yourself and others at danger because you're essentially behind the wheel of a weapon. The long-term effects are things like increased risk for heart disease, including atrial fibrillation, coronary artery disease, and heart attack, stroke, high blood pressure, all kinds of cardiovascular effects. Also, risk for diabetes or prediabetes. And if you already have diabetes, untreated or undertreated obstructive sleep apnea can make your blood glucose harder to control. Untreated obstructive sleep apnea is known to aggravate mood disorders, and it predisposes you to gain weight. So all of these things should be sending up red flags for those who are already diagnosed. It's my mission and my goal to help you get treated as best as possible, and I'm happy to do so. So this has been a review of what obstructive sleep apnea is and just the tip of the iceberg on the problems it can cause. I hope you found that motivating to continue this journey toward full and complete treatment.